Hey guys, Don here. Welcome to the $1 Million Minute, and I'm going to go over the things that happened in the practice today that helped me get to the $1 million mark and beyond. So today I'm recording it. This is a Wednesday in our office, so I'm in my Westboro office. This is an office that's been open a couple of years now, and so there's a little bit more opening. So I had 13 appointments. There's 3 hours open. So what happened today is they were able to fill a few of the slots. But then I was able to finish about 3 o'clock. So I was able to go home early, which was a nice thing. But it is always a little stressful for us when we're opening a new practice, not having it as busy. And then we're still also, I think I mentioned before, we're having some staff issues. So some staff leaving, other staff following them, some staff going to professional school or wanting to do another specialty. And so, there's always the staff issues. I've talked to a lot of doctors. They all kind of struggle with it. I think we all kind of do that. But we just kind of keep going, and I'll go over kind of what happened today. So the first patient was a 47-year-old gentleman. I saw him a couple weeks ago. I did an anterior ankle joint injection. He was feeling a little bit better, but he is dealing with some hip issues. He had a labrum tear, and he is going to be doing with a Boston Sports and Orthobiologics group a series of probably, I think it's hyaluronic acid and some PRP in his hip. And because of that, he does also have a wart on one toe, so I did cantharidin treatment. I offered him Swift. He probably would have normally done the Swift, but since he's going to be dropping a few $1,000s on his hip, he's not doing the Swift. So we did cantharidin for him. He also had that anterior ankle pain issue, and it could be from his hip as well, so I'm going to send him to physical therapy. His pain today was more around the peroneals, so I'm going to have him go to PT. He's going to follow up after PT. Next patient was a 58-year-old female. She is here for her third Shockwave for the first MPJ, so arthritis to the first MPJ, hallux limitus. She has a carbon fiber inlay in her shoes. She's already feeling better after this third session. I want to be clear, I don't think Shockwave brings back cartilage, nothing does, but it is able to help reduce the bone marrow edema around there. And I'm going to see this patient in 12 weeks, because I think for bony issues, it's going to take longer for that to improve. So third visit, on the last one, I do a level 3 visit, because I'm kind of discussing what's next for these patients. Next was a patient that I did an amnio for the Achilles. He had some Achilles pain, status post exhaustectomy with another doctor, and he was quite a bit of pain. He's doing better now by number 5. He's feeling much better. So we're going to do one more, and then he's going to give it a big break. But he is pleased with everything. He did tell me he felt like a pop over the weekend that swelled up a little bit on the lateral aspect, but everything looked fine. Today I did a quick ultrasound just to make sure. Next patient was a new patient. This is a 65-year-old person that had a 5th metatarsal shaft fracture. Kind of a weird injury. Something hit it, and then they kind of twisted their foot. It was kind of like a spiral oblique fracture of it with some gapping. And because of that gapping, I said that it might be slow to heal, especially with this big gap in that area. We talked about either fixing it. It was kind of on AP, it was an okay alignment. On the oblique, you could really see this gap, or this almost like a green stick type of a break. It's kind of going up in the center, and I recommended doing some Shockwave to help that to heal a little bit faster. So we did focused only. So I think if it's a fracture, I'm doing focused only. Because otherwise it just hurts too much. So I did focused only session number 1 of 3, and I'm starting to do this when I tell the staff. I just write in the note number 1 of 6 or number 1 of 3, and then I do focused or combo. So they know. So I don't have to put in like scheduled 6 sessions. They just know that it's 1 of 6 or 1 of 3. Next patient was posterior tibial tendonitis and kind of tendon pain. This patient was this avid hiker. He already got his orthotics. This was number 2 of 6. He's quite a bit of swelling, but he's been feeling a little bit better. Next patient was a 76-year-old man that just had some foot pain. It's feeling better, so just a quick office visit for him. Next patient this is a patient that wasn't there when I got there and ended up being one of my MVP patients. So this is when they must have fit in. He is a young guy. He's a 33-year-old guy, and he has bilateral heel pain. And so let me explain what happens. So normally with heel pain, as I've mentioned this before, I usually do anti-inflammatories, icing, foam rolling, things like that. Now this gentleman, he had been dealing with this for a couple of years. He wasn't really sure what he had. It ended up being plantar fasciitis as I pushed there, and more importantly, it was bothering him when he gets up, when he's active, and he has a hard time standing for longer periods of time. So I said, you could try this initial treatments for about 3 weeks, and then they'll see you back, but a lot of times that just delays the improvement for 3 weeks. And he opted not to do any of those things because he already had a night splint, he already had done anti-inflammatories and icing and things like that, and he opted to do Shockwave. Now, the interesting thing is that he had plantar fasciitis bilaterally, so he had a thickness and effusion about 6.5 millimeters on the ultrasound. So this gentleman needed bilateral Shockwave. And so that's going to be expensive, and he scheduled him for bilateral Shockwave, and then also for orthotics. And I'm going to do the orthotics on the 3rd session. So once it starts to feel a little bit better, then I'll be able to get into the orthotics by the end. Because I think if you do orthotics right away, they are painful because nothing really feels good. His shoes were already good. He had Hoka shoes. I did talk to him about amnio as well, and I do sometimes amnio. It's more of like a technique that's called. It's not positioning, it's called, like, you set a base level much above what it is, and then you kind of go down. And so if you do amnio and all these other things, it would have been about $6,000, $6,600. And so I said, we could do these amnio, which like speeds things up, which would be about $6,600. I don't think you need that. I think what would benefit you best is the Shockwave. So Shockwave for bilateral Shockwave is $3,000, so it's $1,500, so it's $1,500 for each side, and then the orthotics. So he did that today, and he set up the 6 sessions, and I did the first session today. So I think a lot of it has to do with speed of treatment. So as much as you can do things right away for patients, they like that. Next patient was a 62-year-old female. She was on her 2nd round of diflucan. She was seeing some improvement. She did have one of the nails that just wasn't responding. And I sometimes think, actually I didn't think this, but a rep came by and told me this. He came in trying to talk me into prescribing Jubilee, and he said that sometimes they have these like fungal packets in there or something like that, these like packages of fungus. And that made me think, possibly some of the reasons that these aren't getting better is because they have these like fungal packets in there. So I took a grinder. I don't normally do this, but I ground down the nail that wasn't responding. And so we'll see if it works with this next round of diflucan. Next patient was a plantar fasciitis 37-year-old patient that is on number 5 of 6. She's almost better already. So one of the benefits, I think, to doing 6 versus just like 3 or 4 is that by the 6th one, usually they're responding well. Next patient was a patient that I'm going to be doing a bunionectomy on, and we did a Shockwave for her to help with healing post-operatively. So she had Shockwave with the silicone-tip. So I think silicone tends to work better for bone, like first MPJ, also for arthritis. So those are the ones I'm using, the silicone-tip. Then I'm going to do it. Then I did focus Shockwave as well. So she has one more session. So we do 3 sessions, and there's going to be one more right before her surgery within 72 hours. Excuse me. Next patient was an ingrown toenail, did an IND. So this gentleman has some chronic ingrown toenails. He was seen in urgent care. I did an IND because there was so much swelling and a granuloma, and I'm going to see him back in 3 months, and I said most likely we're going to do a matrixectomy at that time. And then another patient was a patient that must have been added on during the day as well, and this patient was a 41-year-old. He had cellulitis and an abscess on the 5th metatarsal laterally, and he thought it was a Taylor's bunion. He was like, is this a Taylor's bunion? And I said, no, you have an infection, an abscess. I popped the abscess, put him on doxy, and I marked the area of the cellulitis. And if it gets worse, I told him to come back, but I did a kind of an IND on that, and then the prescription. And then the final patient of the day was another patient that she had failed terbinafine, put her on diflucan. She's doing better. I did avulse the right hallux, and it's kind of growing in more normal. I'm concerned that sometimes if these they were growing really thick, I get concerned, and I tend to do a Onifix on that. She might need an avulsion on the other side, on the left side. So if she comes back for that, because it's a very thick nail, hasn't really responded to Benefin or diflucan, so I may remove it so it can start over and then do maybe an Onifix on the other side. So that was the day. It was a good day. I did do some marketing, so I had some time, and there was a week ago or so, I did a talk for some primary cares at a group called Charles River, and I asked them after the talk, I'm like, hey, can you send me the list of the docs in that group, in that pod? And they sent it to me. And so I reached out to a couple of them, asked them if they had any doctors that they referred to, and I sent out a couple of things. Let me tell you what I sent them. I sent, we have a little brochure, like a 3-fold brochure. I sent them some business cards, and then I sent them a couple of documents. One document is like what we can do for you, and the other one, which I should have sent that I didn't, is like a referral page that they could just fax over referrals. But I want to tell you, this whole thing, for me doing this is really uncomfortable. Like calling the front office, asking them if they have a doctor referred. I would love to have my staff do that. I just don't have a great staff person. What I would really like to do, and if anyone has a good idea, I would really like a rep for our practice. Someone that I can just pay by the hour to do this work, to kind of reach out, that has, I don't know if it's very confident or just has a really ability to get used to saying no. I think this would really help us to get in front of these doctors, give them helpful resources, and do this. If any of you are doing this with a practice rep, I would love to know how it's working for you, how you found the person, how much you pay them. I would love a rep that I could pay as a percentage of the new business that they bring in, versus just hourly, because you don't know if they're motivated or not. Usually, if they're motivated to work on commission, then it's a better thing. So that is the ideas for the day. Please let me know if you're liking this. Shoot me an email, don@podiatrypracticemastery.com, and let me know kind of other things that are working for you that I can help share with others.